This is just what I was looking for. The Community Mental Health Act of 1963. Let me back this up just I had to get this in here. It was an act to provide federal funding for community mental health centers and research facilities in the United States. This legislation was passed as part of a John F. Kennedy New Frontier. It led to considerable deinstitutionalization. The CMHA provided grants to states for the establishment of local mental health centers under the overview of the National Institute of Mental Health. Over half of the proposed centers were ever built. None were fully funded, and the Act didn't provide money to operate them long term. The CMHA proved to be mixed success. Many patients formerly were housed in institutions were released into the community. However, not all communities had the facilities or expertise to deal with them. In many cases, patients would wound up in adult homes or with their families or homeless in large cities, but without the mental health care they needed. The American public mental hospital patients declined from a mere 550,000 in 1955 to fewer than 40,000 at the present. The displaced patients now represent 30 to 50% of the homeless population. I want to go back up here and do this again. I'm not going to talk, I'm just going to let it sink in. Thanks for watching, guys. I mean, this is something that your politicians really need to hear. Thanks.